Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752. And if you're new to the program or just joining us, we are talking about musculoskeletal pain or orthopedic pain. So if you've got any joint pain, back pain, neck pain, shoulder pain, anything like that, stiff joints, dull aches, give us a call. You'll get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy with the byline of Regenerate, Don't Operate. So call us, find out what that's all about, 866-870-5752. Check out the website at www.lastemcells.com. That's lastemcells.com, where you can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. So we have Kelly back, and let's see. Should we go to Kelly, or did you want to say something?
Well, number one, my name is Dr. Marc Darrow. I'm a medical doctor, and I've been doing regenerative medicine for 20-plus years.
Yay.
I'm told I do the most of anybody on the planet. I don't know if that's true or not, but I am a busy guy. When I go to national meetings, a lot of docs come up to me, and they go, I've heard about your practice. You do as much of regenerative medicine in one day that I do in a month. And I go, where'd you hear that? And they go, well, I do this many. And I go, why do you only do that many? Because it's one of the greatest healing techniques there is. So yeah, I mean, we use platelets from the blood, and we get platelets and stem cells from the bone marrow. And they're amazing healing techniques. It's done with an injection. It's very simple. It's very quick. You can walk in the office, get injected, and walk out. And I mean, it's not that fast, the whole process, in terms of how we have to spin the blood for PRP. And, there's paperwork and all that. I'm just saying, in terms of conservativeness, you don't have to go to an operating room, you don't have to get anesthesia, you don't have to have your body opened up, you don't have a recovery period like that from surgery. In all the years I've been doing this, people have walked out healthy. So surgery, unfortunately, has a lot of potential side effects. I had one on my own shoulder that was operated on while I was in my 4th year of medical school. I have a jaundiced eye about surgery. I do love surgeons because it's hard work they do, but I don't like the surgeries for the most part. So I'm going to go to Manuelito. Did I pronounce it right? Are you with us?
Manuelito? Are you there?
Yes, good afternoon. This is Cruz.
Did we say your name correctly? Manuelito?
Hello?
Yes. Can you hear us okay? Okay.
I can hear you now.
Great. Okay.
Okay, good. So I'll call you M. It's easier for me. So M.
There you go. I
your
usually just go by Cruz.
Oh, Cruz. Okay. Cruz is even cooler. Then you're. I'll pretend you're Tom Cruise.
There you go.
So you're.
All the time.
So your legs and knees bother you. Oh, thanks for
Yes,
calling.
sir.
We appreciate it. Thank you so much.
Well,
God
thank
bless
you,
you.
brother. I truly appreciate you taking my call. I didn't know I was going to get right in, but that's how he works. Anyway,
Yeah, good.
I'm an electrical
So
contractor.
how long have your knees bothered you for?
Since junior high. Basically, I had a
Oh,
gunshot wound to my abdomen, which I
Okay.
guess shook everything up. I think it chipped my tailbone. So basically,
Okay.
I've always had leg, knees, ankles, back, neck pain, basically.
oh wow.
And now that I'm older, I'm an electrical contractor, so I'm constantly going up and down ladders and all that stuff. It got to the point to where when I'm getting out of bed, I would have to hold the wall to go to the restroom. So a lot of throbbing at night. This past year, I decided to take Relief Factor, which I'm 100% behind that right now because it's helped out a lot. I do wear knee braces, padding. I have lifts in my shoes. And I got to constantly buy new boots every 6 months to a year because if they wore out real good, my knees and my back hurts. So I don't know if you can help me or suggest something. I would like to make an appointment, come see you, because it sounds like you are the man to take this pain away. I'm not a believer in taking any narcotics or painkillers. They want to put me on all this stuff, and I'm like, no, thank you. So basically, I just lived with the pain.
Okay.
Go ahead.
You know, the thing about this, Cruz, is there's no way I can tell you if I can help you until I examine your body.
Exactly.
I don't care what your MRIs say. I don't care what your x-rays say. I like to have them for additional information. Sometimes, believe it or not, I've gotten those and found cancer. So I like to be safe and get an imaging and, do my due diligence and everything. But really, my hands are going to tell me if I can help you. I have to touch it and move you around. The examination is everything. And you may have a lot of things that show up if you have MRIs or x-rays, and they may not at all be the cause of what you're feeling. So it sounds like I can help a lot of this stuff. I don't know if I can help all of it, but until you come in, and I will give you the phone number to the office if you have a pencil and paper. It's 800.
I believe I have it. It's 800-300-9300.
You got it. 800-300-9300. And you can call there, right now or after the show, after we're done talking. So I don't really know what's going on with you yet. Typically, you're still very active as an electrical contractor. So you got to keep going. You got to support yourself and your family. Exactly. And I understand that there's a lot of times when I have injuries where it really hurts to do my work. I never talk about it, and I just keep going. And so God bless you for doing that and working through the pain and not being a complainer about it. Yeah, it's real important that you're a strong enough person to work with the situation that God gave you. I look at everything as spiritual. So when things that I have other people would think I'm suffering from, I don't suffer because I work in the spirit as much as I can. Okay.
And that's exactly what I do. If it wasn't for him and the life I have, it's truly unbelievable. So
I'm so blessed. It sounds like you know that you are also, and I live in that. I actually meditate an hour every day on all the blessings that I have, and I have so much gratitude for everything, even the things that I don't quote like. Okay, whatever it is, I go into a state of bliss for an hour, just me and spirit. I lock the door. And my phone is away from me and turned off, and I go to spirit. And that helps me in my life. And it doesn't matter what's going on. The things that irritate me seem to balance out. And I teach my patients how to do this, believe it or not. Anybody who's open to it, I show them how to meditate and how to get to the inner part where the spirit is. Because we can look out through the eyes and see the world, and that can be really disturbing. But when you look in, what's written? What's written is the kingdom of heaven is inside, right?
Yes, sir.
Well, how do you get there? You've got to stop. You've got to get away from the world and give yourself a private time. And sometimes it takes me an hour to get there. And sometimes even with an hour, I don't think I've gotten there. But I've been doing this, believe it or not, for 50 years, every day of my life. I never miss a day. So for someone like you that has this chronic pain.
After my stretches and my yoga in the morning, because that's how I get everything lined up, I literally flat on my face and I go in my prayer mode and thank you for who I am, what I am, what he's given me, what he's blessed me with.
Good.
And the whole thing about stepping back and from the world, I'm a firm believer that I have spiritual advisors that advise me to do all that stuff. So, because 20 years ago, I didn't live the life I live today, and it's all due to doing the right thing, taking the next indicated suggestion for our lives.
Yeah. The way I look at life is so simple. We have choices every second. And in those choices, some of them we will not be happy with the results, and some of them we know will be happy. The biggest choice is keep your mouth shut, right?
Exactly.
Isn't that the biggest choice?
Never pass up the moment not to say anything, because once we open it's all bad.com.
So
That's
my
another
grandfather
belief I believe in.
my grandfather was a doctor and a philosopher like I am, and he used to say, "Keep your shoes shined and your mouth shut."
Exactly.
That was the main thing he'd tell people. They'd ask him all these questions, and he'd say that.
That is hilarious.
So, Cruz, I think there's good hope I can help you, but I got to actually touch your body. I'm going to give you the phone number again. It's 800-300-9300 to come in to see me. There's people at the phones now if you want to talk to them and see how to do that. And for those of you that want to call in and talk to me live right now about your medical issues, hopefully orthopedic, musculoskeletal, neck, back, arthritis, fingers, toes, shoulders, hips, you name it, anywhere. I inject really all over the body. There's nowhere I don't think I've injected. I mean, I'm not going to inject your eyes or your ears or something like that. But TMJ, temporomandibular joint, yep, we help those all the time. So a lot of things that your doctors don't know that can be fixed. Kelly called up before. She was told that she has degenerative disc disease and nothing could be done. Well, that's not true. I work on that all the time. Every single day I do back injections with people that have that. Spinal stenosis, most people it's not the cause of their pain. Some people it is. So, if you've got spinal stenosis but you have low back pain or neck pain, I can usually help that. I can usually assist the healing in that. So there's a lot I can do that traditional doctors don't know about because they don't really understand and don't want to know about regenerative medicine. They follow the old trodden path of drugs and surgery and physical therapy, which none of those things am I for. I'm not against physical therapists or physical therapy, but an awful lot of people that come in my office have had all of those things without any success at all. So, I'll just be honest. I don't send people to physical therapists. If they're very old and they can't move, I'll send them right to a physical therapist. But generally what I do can help people heal without the things like that. Okay, and that's not a negative statement about any of it. I love all the people involved in what they do, but I don't see the value in it personally. I hope that doesn't make anybody angry. I'm just talking my opinion. I'm allowed to have it.
That's right. We say so. So, did you have any more questions, Cruz, for Dr. Darrow?
No. In fact, I will call the office and get an appointment and get them as soon as possible. I was going to do that last month, and you know how life is. You just get busy, and then there's just blessing today. I'm on another site and got my earplugs in, and your show came on again. I was like, man, I got to call this guy. And here I am.
Oh, wow. Thanks so much. I really appreciate your call.
Yes, definitely.
Cruz,
Thank
God
you.
bless you. And let's
you,
pray for
appreciate
you and know that you're going to get better.
Thank you. I'll see you soon.
Yeah.
Okay, thank you.
All right, thank you.
Our number is 866-870-5752 right here in the studio. That's 866-870-5752. You can speak directly with Dr. Darrow about your orthopedic pains and aches, and you can check out the website at www.lastemcells.com, where you can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. That's www.lastemcells.com. So I bet you have a question.
I want to say one thing, Nita.
Yes.
I want to say one thing. So we just talked about spirit, and we talked about meditation. We talked about blessings. We talked about things that a lot of people associate with religion. None of what I do is religious, okay? Mm-hmm. And I just want to say these things are actually scientifically proven. There are studies that show that long-distance prayer, not even being in the room, gives better results during surgery than no prayer. So I'm not talking about this from a religious point of view. I'm talking about it from a scientific point of view. Okay?
Yes.
So those of you that may have had a problem with me talking like that, because I know some of you would have, it's not what you think I'm talking about. I'm talking about science. Okay? There's science on meditation too.
Yeah.
Lowers blood pressure, gets rid of anxiety, makes people very, very happy. So works for me. If it works for me, it can work for somebody else.
It works for me. Lowered my blood
so
pressure.
I'm going to give out right. I'm going to give out the phone number to talk to me right now. We have a few minutes left. If you want to talk to me live, the phone number is 866-870-5752. That's at the KRLA studio. 866-870-5752. And in the meantime, I'm going to actually, I think what I'm going to do, Nita, is tell a couple more jokes.
I knew you were going to say that. I knew you love to stump
me.
you.
I do, because I love hearing you laugh. Okay, you ready? Get ready.
I'm ready.
Have you heard about the corduroy pillow? It makes headlines.
Oh, my God.
Okay, what do sea monsters eat?
Little baby fish.
Fish. Yeah, you're half right. Fish and ships.
That's pretty cool. I like that one.
You know, I love being on the show with you, Nita, just to hear you laugh. It's so amazing.
And now I'm hungry for fish and chips, don't you know?
Yep.
Yeah, I'll let you buy that for me sometime.
You became Canadian for a second, don't you know?
Don't you know? Yeah. Or Fargo, North Dakota, yeah. I know. I do voices. Yes, I do. I have a lot of fun. You see, that's why we get along so well all these years, because we both live in the fun zone. That's a truth.
I try to.
That's a truth.
Yeah, I try to. My patients are always like, why are you always cracking jokes? How come you're not a stiff doctor? And I go, because there is what's the book called? Laughter
is the best
by Norman
medicine.
Cousin.
Yeah,
that's right. Laughter is the best medicine.
That's right.
So I like that kind of medicine. I like the laughing medicine.
We do.
Okay, we're going to go to Peter, who's calling in about his legs. Peter, how are you today? It's Dr. Marc Darrow.
Good morning. Thank you for taking my call. How are you today?
I'm excellent. God bless you. Thank you.
Thank you. God bless you likewise. We tried stem cell. Heard your ads, your information on Saturday mornings. Ended up going to a doctor in Garden Grove, Korean doctor. We thought it was you. We ended up with a different phone number. My wife and I both went. It cost us about $24,000, and we did not only the stem cell for each of us in multiple areas, but we did their regular weekly treatment for 12 weeks and had virtually no result. My question would be, are you the type of patient for that type of treatment, or is it something else?
How many stem cell treatments did you have, and to what part of your body was it?
In the leg and back, and we did. There were 2 or 3 shots that day, but it was all at one time, never anymore.
Okay. So you had 2 or 3 pokes in both those areas, or one area?
Yes.
Okay. Number one, that's not enough. Okay. I don't know who the person was. I don't care to know. I don't like to badmouth other doctors, and I don't like them badmouthing me, because we all have our opinions. But I'm telling you, that wasn't enough to be able to heal anything. Okay. Number 2, the price is, well, sometimes it's not going to do anything right away, and sometimes you need a lot of different treatments. How many times did they inject you? Over what period of time? You had 12 weeks of treatment.
One day.
Was it? Oh, just that one day? That's not going to do it.
Only that one day, and we went back every week for 12 weeks for manipulation, a little bit of Rolfing type stuff, electric things on your, that kind of stuff.
Yeah. I'm going to call you later to find out who that was. I don't want you to talk about it on the radio.
That's fine. That's why I didn't mention it over the phone.
Because I'm going to make sure that I stay away from that. I don't want to go near something like that with that high price. And
both of us went in for different issues that we tried to solve for years and couldn't. My wife's competitive ballroom dancer, Latin International, very, very, very strenuous. And
where did they take the stem? Where did they take the stem cells from, by the way?
I don't recall. I can't recall. I just recall that they...
Was it from your body?
Oh, yes. Yeah, from our body.
Okay. So did they take bone marrow, do you think, from your pelvis? Did they just take blood?
No, they didn't get into the bone. I think that... I don't think so.
Did they draw your blood? That's okay.
Drew the blood,
your blood.
The blood, did whatever they did, and about half hour, 45 minutes later, they injected it.
Yeah. Okay, so you never had stem cells, okay? That's number one.
I understood we were getting stem cells, but maybe we didn't.
Well, that's fine. I'm just telling you, don't get stem cells from the blood.
Okay.
There might be a couple in there, obviously, but that's not how you do stem cells.
Oh, and they had something where we got 5,000 or 50,000 of these units or that. No, it was from a bank.
Okay. So they were using probably purchased afterbirth products, which the FDA as of June umbilical cord. So as of June 1st, the FDA, Federal Drug Administration, has said they're going to start prosecuting doctors who do that. So I don't do that.
This was in March.
I don't need a prosecution.
No. Nobody does. I don't need one either, actually.
Yeah, exactly. Well, you won't get in trouble, but they may get in trouble.
No,
Are they chiropractors too? Were there chiropractors there?
Yeah.
Okay. Yeah, there's something that doesn't sound right to me, and that's okay.
You're welcome to call me later at this number.
Yeah. You got it, man. We'll have a talk, and hopefully I can help you.
Thank you. I'll be around all day.
Okay.
Thank you.
All right. God bless you, Peter.
God bless you,
Thanks
too.
so much for the call.
Yeah. Thanks for your call, Peter. Our number is 866-870-5752, right here in the studio, 866-870-5752. Do you have another joke or a question?
Well, this is not a joke. I'm going to tell you guys something. So the FDA is mainly out to go after chiropractors, okay, who are doing stem cells. And it's mainly the false advertising that comes with it. And, I love chiropractors. I had a chiropractor as a partner for 10 years. He was a healing magician, believe me. So I love chiropractors. But when they get into advertising to get patients to do stem cells and charging a fortune to do it, that's where the line is drawn. And that's mainly what the FDA is doing now. They're closing down these chiropractic clinics that bring in a doctor who doesn't really even know how to do the injections. Like it sounds like Peter had some work done on him that was done, not in the best possible way. When I inject a back, I'm going to probably do at least around 10 or 15 injections. Okay? So, again, I don't like to comment on other doctors, but you guys listening need to know that you got to be careful who you go to. Go to someone who only does this kind of work of regenerative medicine, and stick to the chiropractors who are manipulating the body and doing what that does, but not hiring doctors who don't know what they're doing to do this work.
Well, you wouldn't go to the hardware store and try and buy orange juice, right? It's kind of like that kind of thing. Like what you need is you have to go to that person. Because you're always saying on the show, you have to go, you have to find out who does this the most or is the best.
Whatever doctor you go to for whatever reason.
Yeah.
Find out who does the most of the procedures. That's the guy that has the most experience. Nita, why did the photo go to jail? Because it was framed.
Oh, my God. Okay, thank you, everybody. Thank you, Alex. Thank you, Suzette. Thank you, Dr. Darrow. Listen to The Pet Show 11 to 1 with our pal Warren Eckstein every Saturday. I'm your host, Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.